Truth is, 100% of the pain you experience is produced by your brain. But that doesn't mean it's all in your head. However, we also want you to understand that just because you have pain doesn't mean it's all in your tissues. So that's what we're going to dive into in this video as we explain what was wrong with the old models of pain and advancements in the new model. For a long time, pain has been explained through the PSB model. That's short for postural, structural, and biomechanical. Essentially what this model says is if you have pain, then there's something wrong with your posture, the way you move, or your anatomy. The problem with this model is it's mechanical only, meaning it can't explain chronic pain, phantom pain, or why some people don't get better after months of rehab. Now, I'm not saying that we throw this model out completely. The PSB model is wonderful for acute injuries, like when you sprain your ankle or pull a muscle. It just simply leaves out the full picture of pain. The better approach we adhere to is the biopsychosocial model, where we look at all the factors that influence your pain, not just your tissues. The bio stands for your body, and this is where we actually look at your posture, anatomy, movement, and injuries, and this is usually where acute pain starts. Psycho stands for your mind. This is where we look at stress, anxiety, emotions, and your beliefs. And what we've learned through modern pain science is chronic pain is often tied to your emotional history and mental health. And social stands for your relationships and environment. This is where we look at how isolated you are, if you have lack of support, financial strain, or work stress. And oftentimes this section gets neglected the most in the healing process. And I get why. It's easy to forget or not even acknowledge how social disconnection can amplify pain. The reason we love the biopsychosocial model is because it shows that you're not broken, you're not stuck, you're not weak. You just need a complete map, one that shows your entire life, not just your tissue. In the next module, we're going to cover how pain works. Get ready.